Okay, let's call to order here. I do see all commissioners present and accounted for. So I'm going to skip the roll call and ask for approval of the board meeting agenda.
Commissioner Spikers, may I ask to add an executive session to the end of the meeting, please?
Sure. We
Thank
will
you.
be having at the end, the very end of the agenda, so that the public doesn't have to wait around, a executive session. And that will be the only difference in the agenda. All in favor of that agenda, I'd ask, or do I have a motion to approve it, I should say?
So moved.
Do I hear a
second.
second?
Second.
Okay. Any other discussion on that motion to amend the agenda to include an executive session at the end of the board meeting? No, I'm hearing no discussion, so I'm going to ask for a vote. All in favor of the amended agenda, including an executive session, say aye.
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 Okay, carries 5-0. Next item is the public comment. Do I have any public comments? No public comments?
Commissioner Spikers, I'm not sure if you're able to see it on your screen, but there are many hands raised. So I think the best way to do this would be to ask Jennifer to call on people that have hands raised, or if there's others that would like to speak, if they raise their hands, she can call on them.
The mic is on.
Okay, I'm just going to point out, if this is a session for grievances against the board or any employee of this district right now, I'm going to call that, at this point, call to order, and I'll not take those public comments. Those are best heard in front of HR or directed in an executive session. So with that, do we have public comments?
Commissioner Spikers, would you like Jen as the secretary for the board to call those with their hands raised?
Sure.
And Brandon, I know Skip is at the game. Would you be willing to help keep time and mediate for us?
I'd be happy to. I'm prepared, and I talked with Skip before today's meeting. I'm ready to move forward.
Great, thank you.
Point of order. Point of order.
Yes, is
I
that
would
Commissioner Herron? What's your point of order?
I would like a commissioner to assist in calling the public who are
Okay.
present.
Okay, first of all, I don't see any hands raised, so I don't know if there's any raised.
Okay.
President Spikers, if you want, I can, because my view on my Teams has hands raised and there's even a number that
Okay,
shows, I think, the order in which. Do you want me to help?
yeah, that'd be fine. Thank you very much. I appreciate it, Commissioner Carter.
Okay, the first name I see with a number 1 next to it is Blake Lord Wittig.
Okay,
Good evening, Commissioner. Hi, my name is Blake Lord Wittig. I'm the Director of Food and Beverage and the head of the Dietary Department at Snoqualmie Valley Health. I have had the unique privilege of seeing this organization through a different lens than most, where hospitality, nutrition, and community intersect with healthcare. What makes this place exceptional starts with the leadership, especially our CEO, Renee Jensen. There's a clear vision to move beyond sick care and truly support people living well every day. And that vision shows up on how we think about food. Food is a part of everyone's wellness journey. It fuels recovery, supports long-term health, and creates connection. Because of that leadership, our culinary program isn't just a support service. It's a meaningful part of the healthcare experience. You see, that philosophy comes to life in the Hub, a project that's reshaping what healthcare can look like, more proactive, more connected, and centered around community and wellness. Personally, my background has not been in hospitals, it's been in hospitality. But the support and vision of our executive team has made my transition not only possible, but incredibly meaningful. Their leadership has created an environment where ideas are backed, people are empowered, and real progress happens. It's because of that support I couldn't see myself anywhere else. Being a part of this team, helping it thrive, and turning our shared vision into reality is something truly special. And that's the kind of culture strong leadership creates. And it's why I'm so proud to be here. Thank you for your time.
Thank you very much for the comment. I appreciate it. I'm sure the board does. Do I have the second comment here?
Next comment would be Mayor Miller.
Good evening.
Well, welcome, Mayor Miller.
Well, thank you so much. It's an honor to be here. I'm actually quite pleased to be here. President Spikers and board members, it's a pleasure. My name again is Mary Miller, Mayor of North Bend, and I'm here tonight to express with respect my strong support for Renee Jensen. I have listened to your last two meetings and feel it's always important to speak the truth and from the heart. In complex organizations like hospitals, leadership isn't just about operations, it's about trust, stability, and the ability to guide teams through constant change. This I know for a fact. Through her openness to be creative, grew a partnership with myself and the city of North Bend, and that springboarded the opening of the Snoqualmie Valley Clinic in North Bend, a much needed addition in our community. And let me tell you, the response from our community has been phenomenal, and I watch for that and I listen for it too. From what I have seen and experienced, Renee brings these incredible qualities and more to the Snoqualmie Valley Hospital. Furthermore, effective leadership in healthcare means balancing patient care, staff support, and long-term sustainability. This isn't easy, especially in today's environment. It requires clarity, accountability, and the commitment to the community that this hospital serves. And Ms. Jensen has demonstrated those values, which again, I appreciate. Continuity in leadership matters. Progress takes time, and we have been seeing amazing strides with the groundbreaking construction with the hub as a prime example. Strong leadership deserves the opportunity to continue to work. Supporting Renee Jensen is not just about one individual, it's about supporting stability and forward momentum for this hospital and the community that it depends on. I appreciate and value her. I encourage the board to recognize the importance of steady, thoughtful leadership. I thank you all for your time, and I wish you well.
Well, you should have been on the agenda as a.
Oh, I talked a lot. I try to listen better, though. Thank you very
All
much.
right, thank you very much, Mayor.
You
We have a
take care. Thank
third
you.
person?
The next hand up is Kelly Bender.
Hi, thank you for having me this evening. I serve as the outreach manager, and I briefly wanted to revisit my comments from last month. They were shared with intention and respect, and I believe speak to something important. How we show up in these meetings matters. As someone working closely with both our staff and the community, I can say that people are paying attention, not only to the board meetings and executive team, but the discussions that are taking place. I also want to acknowledge and thank those that have taken time over the past month to ask questions, to listen, to engage, to deepen the work happening across the organization. That effort matters, and it helps move us forward in a constructive way. As we continue shaping the work of the hub, we have meaningful opportunity in front of us. The success of this work depends not only on the strategy and execution, but on the alignment, shared trust, shared commitment to be respectful and engaged leadership. At the end of the day, how we show up in this room matters because it not only shapes the success of the hub, but the trust our community places in all of us. So thank you.
Thank you very much, Kelly Bender.
All right.
I believe there's
President-
one other person.
I see two more.
Right.
Next up would be Chantal Postiglione.
Good evening, everybody. Can you see me okay? Okay.
Yep.
Good evening, commissioners. My name is Chantal Postiglione, and I'm a family nurse practitioner at Snoqualmie Valley Health. Thank you for the opportunity to speak. I'm proud to work here at SVH and care for this great community alongside Renee Jensen and her leadership team. I've been here for the past 4 years now, and in the past, since she started, I've seen the exponential growth for our community. I'm so grateful to also be part of such a great health system that truly respects advanced practice providers like myself as a nurse practitioner. I'm really excited about opening up the clinic in North Bend, as Mayor Miller has said, since late last year, and the great feedback we've received, and also the upcoming opening of the hub later this year, both important steps in improving access and shaping the future of our Snoqualmie Valley. That said, I feel compelled to share concern. At the last board meeting, the tone and conduct displayed has been difficult to witness and may affect how our organization is perceived in our community. Professionalism is essential to maintaining trust. We all share the same goal, right? Delivering excellent care and ensuring the long-term success of our Snoqualmie Valley. I hope to see the progress and stability our leadership has built continue to be supported and thrived. So please do not get in the way of me and my fellow providers and staff caring for our lovely Snoqualmie Valley community. Thank you.
Well, thank you very much. I appreciate your comments. we have
Final
one other?
hand, Kaylin Reeve, and I also see Mary Miller, but I think she just forgot to take her hand down. So I think we've just got Kaylin Reeve next.
Right.
There are actually two others after Dr. Reeve.
Thank you. Hi, I'm Kaylin. I am speaking to you today not only as a provider with the organization, but as a neighbor to many of you, a community member, and a patient who has also received care here. I just want to preface that this is not for sharing grievances or complaints, but really just my deep confusion and hope to bridge understanding. After attending last month's board meeting, I left with significant concern regarding both the tone and content of discussions reported from prior meetings. Remarks perceived as negative towards the hospital district reflected of a level of criticism that, whether intended so or not, came across as dismissive of the people doing this work every day. Our staff consistently demonstrates professionalism and serving our community with excellent care, while often navigating challenging circumstances. Statements suggesting that this is not a five-star hospital risk undermining morale of these essential staff and fails to recognize the amazing services that we provide. It is also important to address apparently a lack of alignment between the board and the executive team. Since Renee Jensen has assumed the role of CEO, and I have seen this, there has been a clear, measurable improvements in operations, processes, and community trust. Renee, Dr. Moore, and the leadership team have shown a strong commitment towards moving this organization forward. That progress should be reinforced through partnership and shared accountability. Continued friction at the board level creates unnecessary barriers to sustaining this momentum. I want to acknowledge the managers and community members who spoke out at the last meeting. Their willingness to speak candidly and advocate for their teams demonstrated professionalism and courage, and it has been noted. I was deeply moved by this advocacy, and I know others were too. We all share responsibility in ensuring the organization succeeds in delivering high quality care. That requires professionalism and mutual respect, and I strongly encourage a more unified and collaborative approach. If there's any way I or other providers in the provider team can help support this alignment, we are ready to be part of the solution. Thank you.
President
Thank you.
Spikers, I'm just looking at the hands raised view, and I see that there's two more people. I believe the next on the list is Carrie Wetzel.
Well,
Sorry if I mispronounced
it appears that we're having a lot of grievances here about the board, and I'm not really cool with that. It's not the proper place, and I think it should go to HR. If you want to have some great things to say about the district or your job, great, kudos to us. But I don't think that the grievances that are now being brought up to the board now, blaming us for not doing certain things or not being cohesive with the administration. This is not the place. So if you have a problem with employees, perhaps the HR division would be best served to hear those grievances. So with that in mind, again, if there's other comments that can be constructive in nature and not critical,
Do it. Be a leader.
have at it.
Thank you, President. I believe Carrie Wetzel is next with those comments in mind.
Thank you.
Hi there. I am Carrie Wetzel. I serve as the Director of Contracting and Procurement for SVH. A significant portion of my time is spent dedicated to the hub, the build and the extraordinary growth going on here in the Valley. As you know, expansion of this scale is complex and demanding. It requires thoughtful planning, operational expertise, political awareness, cultural alignment, and a clear, sustained vision. This level of progress does not happen by chance. It is made possible by strong leadership and a cohesive executive team. The leadership that Renee and the executives bring to SVH has been instrumental in driving the momentum and stability we are seeing today, and would not be possible if you had not selected Renee for her role as CEO. And for that, I thank you. Although I've only been with SVH for the past 8 months, I have worked in the rural healthcare space for many years, supporting many critical access hospitals across Washington state. During my time with the Rural Collaborative, I partnered with SVH under its previous leadership. I'm familiar with the challenges the hospital faced in the past, with a few of you on the board, as well as significant improvements that have taken place since Renee stepped into her role. Now, I don't want to go down grievances, but I do feel compelled to share the concern following the past couple of board meetings that it was concerning to see what was going on in the tone and how the conversations had gone. Healthy governance includes accountability and thoughtful questioning, however, also depends on mutual respect and shared commitment to organizational success. Public criticism appears adversarial rather than constructive and can undermine leadership stability, staff morale, and community confidence, particularly during a time of major growth. It is important that the board and our executive team appear aligned. Renee has built an amazing culture at SVH, one I know that did not exist before her arrival. Having her lead this community is a true gift. It is my sincere hope that the board can continue to refocus on that partnership model and ensure an aligned, unified support and continued progress of SVH, and celebrate the executive team that we have. They are wonderful. It is a big reason of why we're all here. So thank you for the time. And I did try to talk the last 2 board meetings and was not able to. So I appreciate the time today.
All right. Thank you very much, Carrie Wetzel.
Mr. President, I think the last person is Sherry Jennings.
Okay. And she also had a conversation last meeting too, which was not constructive, by the way. It was very critical. So go ahead, Sherry.
Good evening, commissioners. My name is Sherry Jennings, and I'm a community member. I unfortunately don't have a chance to speak with HR, but I want to begin by acknowledging the extraordinary work of the staff at Snoqualmie Valley Hospital District. These are professionals who show up every day to serve this community with compassion, skill, and resilience. They deserve not only our gratitude, but our respect and our protection as leaders. Public hospital districts exist to serve the public interest, and with that comes a responsibility not just to make decisions, but to model professionalism, transparency, and trust in how those decisions are made. The role of the board, especially in the public health setting, is to lead with clarity, collaboration, and decorum. When that standard slips, it doesn't just affect perception, it affects staff morale, public confidence, and ultimately the effectiveness of the organization itself. I would respectfully remind the board that governance is not about control, it is about stewardship. It is about creating an environment where staff can do their jobs without distraction, where community members feel heard, and where differences are handled with professionalism. Moments of tension are not unusual in public service, but how they are handled defines leadership. So tonight, I asked for a reset in the tone and a focus on supporting the people who are delivering care to this community every single day. To the staff, your patient has not gone unnoticed. Your professionalism is seen and it matters. And to this board, the community is watching, not just for perfection, but for leadership worthy of the trust placed in you. Thank you.
All right. Thank you, Sherry Jennings. All right. I guess that's the end of the public comment. Is that correct?
That's correct, President. I think we just need a motion to close public comment, and if we have a second, then we can move on to the next agenda item, please.
I've never had that before, but we'll go ahead and.
No, you don't need that. Mr. President, you don't need a motion to close public comment. You just move on with your agenda.
Yeah, I'm going to move on.
My
to the
apologies.
next item.
I'm new at this still. Thank you.
Okay,
No worries.
the next item, a letter to Tina Spikers on behalf of the board. I'm going to read it. The subject is regarding the OPMA public access concern, January 29th and February 26th board meetings.
Excuse me, President Spikers, I have a point of order.
Let me finish.
It's not from the board. None of us read it.
Okay, well, it's the board chair on behalf of the board, okay?
No, from the board chair. That's appropriate.
Point of order. Please allow the speaker, the chair, to speak without interruptions. This is not a discussion time. Thank you.
I'm going to redo this. I'm going to say that it is from the board chair on behalf of the board. Dear Tina Spikers, thank you for your emails and for bringing your concerns regarding public access to the January 29th Board of Commissioners meeting to our attention. I apologize for the delay in responding. The board takes compliance with the Washington State's Open Public Meetings Act seriously, RCW 42.30, and appreciates members of the public who bring potential issues to our attention. After receiving your initial message, the matter was referred to district administration to review the meeting notice and the process used to provide virtual access. We understand your concern regarding the phone number listed for requesting virtual access. While the intent was to provide a means for members of the public to obtain access to the meeting, we recognize that the process may not have been provided the level of clarity and accessibility expected. We have asked staff to review our procedures for posting meeting access information to ensure that clear and reliable instructions are included in future meeting notices. Moving forward, the district will work to ensure that public meeting notices include more direct and transparent information so members of the public can easily attend meetings in real time, consistent with the OPMA requirements. That's it. Oh, last. Thank you again for raising this matter. Public input is important to the board, and we remain committed to conducting the district's business in an open and transparent manner. All right, the consent agenda is next. Board meeting minutes, medical staff credentialing, and resolution 7270326, approval to surplus public inventory. Do I have a motion for the consent agenda?
So moved.
I hear a second.
I second.
Any discussion?
Again, no.
Call for the vote.
Go ahead.
I didn't hear what was that. Commissioner Bowers saying something? I couldn't hear him.
That was Commissioner Herron.
Oh, okay.
There's just a few changes I wanted to make on the approval of the minutes and consent agenda. And that is, for lack of video recording of January 29, my vote on that was misinterpreted. I think the confusion was whoever was the writer of this misinterpreted my vote on KPIs. So that's why I wanted that January 29. I requested that, and we didn't have any record of it to make it an accurate for minutes. The reason I bring this up is because before I sign as the board secretary, I have to review all of that to make sure everything is accurate. Because it could be misinterpreted and or whatever that happens there. I would really like to see the accurate reporting via recording that should have taken place on January 29, if we were consistently recording them. With that, that's my comments. Thank you before we do the approval.
All right, thank you. And I would add to the comment that those minutes should be available as soon after the meeting as possible, or their approval, I should say. So anyway, we'll be waiting for those, I guess.
Commissioner Spiker, can you give clarification, please, of what was just asked by Commissioner Herron? She's mentioning January.
Who am I talking to? Who's talking
Jennifer,
right now?
You're speaking to the recorder.
Oh, okay. I was.
Excuse me. You asked. You're talking about January minutes, which you already approved.
I'm sorry, not the January 29 minutes, which was incorrectly printed today for this meeting. It was not corrected.
Right. You have to read through the minutes.
There was no.
There was no change to your. There was no change to your vote, and you approved those minutes. So I do not believe we're going to go back and change those. If so, I need clarification on that.
I think what she's asking for is that they be available to the public within, I think that's a OPMA mandate.
So you are talking about all minutes.
I want the accurate reporting of these minutes with the video recorder.
Correct.
So
So
Emma-
video recording
Emma,
is
I need to help Jennifer as she's trying to record the meeting. The confusion is, there is no recording for January. We've discussed this. There was an update with Teams and it was not recorded. And so Jennifer has done her best to record the minutes to real time, and she has provided those. Those were passed at the last meeting. And the minutes are posted on our website once they are approved by the board.
yes.
But the approval.
If there's some direction for Jennifer, we need to be very clear on what that is.
I'm not sure exactly. I think what she's trying to obtain is a copy of the minutes from the January 29th board meeting. That
Which
was
she
approved.
has in her hand because
Okay.
they were approved at the last meeting.
Okay. Well, then, other than that, I think at this point, I'm going to ask for a vote on the consent agenda, because we have a first and second. All in favor of approving the consent agenda? Say aye.
Aye.
Aye. Believe it was a 5-0. Is that correct? Okay,
Correct.
all right.
I did not hear Commissioner Herron's vote. Can she please clarify for Jennifer?
Yeah, let me just read just to clarify. Right here, the reason I wanted to make sure that I am clear, because here it says the time of the, stating that she may have been confused about the motion at the time of the vote and would not support approval of the January minutes. And I said, you misinterpreted my vote. I think the recorder was confused and misinterpreted my vote on KPIs. Yes, strategic plan vote was my yes. But was my no, I'm sorry, and the KPIs is my no, strategic plan is my yes. That's where I am trying to clarify. But because we don't have a video recorder, I wanted to hear whether that's the accurate form.
So Commissioner Herron, you don't need a video recording to change your vote. So at the last meeting, when Commissioner Spikers asked for change, you could have just said, I would like to change this vote, but that did not happen.
No,
And so
I
when they
did.
passed it, if you continue looking down the minutes, you'll see the 4 times that Commissioner Spikers tried to pass it and the words that were spoken, and your changes were not in that vote. And then later on, you did vote to approve it.
If you recall, even Council Hauser says that my vote was taken correctly. And yet I don't see it here. That
Why don't we do
anyway, I don't
this
wanna
rather
go
than
further.
heckle
For the
about?
sake of time, I don't want to go further. Thank you.
Well, no, let's just allow that, the YouTube, are you talking about February 26th minutes, right?
Correct.
The January.
Okay, let's
29th.
just allow that meeting that is on file and available to be the best evidence of what happened. And,
Jennifer,
you know,
it was
if
very
someone wants
difficult.
to, if someone
Sorry.
wants to
Because it was
disagree with
difficult.
the minutes at a later time, that can be done by getting a transcript of the,
So because it was difficult to understand what happened during that portion of the meeting, Jennifer did include the transcript in these minutes. And so that is what is included in their parts of those transcript to be as accurate as possible. And Commissioner Herron, it's okay for you to vote no on this if you would like.
No, that's fine. I just wanted to clarify myself. I'm going to go ahead for the sake of time and for the sake of civility. Thank you.
all right, thank you. So we'll, was it a 4-1 vote or 5-0? Or 4-1 abstain, or what? Commissioner Herron? Okay,
Okay, I'll abstain.
okay, it's 4-4 and 1 abstaining. All right. We'll get to the next, believe me, we will. I believe that General Counsel Hauser is here and he's standing by to give an OPMA review. He was very good at sending us a memo on that. I hope that new Commissioner Bowers looked at it. He's a new commissioner and maybe not familiar with the OPMA. And he's here to give a presentation on the OPMA. Go ahead, Counsel Hauser.
Thank you, President Spikers. And I appreciate the comments. The memo is probably more than you needed or wanted, and I apologize for the length, but I wanted to try and cover all the different aspects. It's a very convoluted, a very interpretive type document, and it's not just for new commissioners. Every time I read about the OPMA, I learn something. It's an ongoing, as President John F. Kennedy said, you have to be adult learners sometimes. You have to continue to learn and learn. And so with this, with the OPMA, we continue to learn. I've included in that document what I think are the variety of types of questions that might be asked, tried to detail some of the statutory references and some of the practical uses. I've also included in that a document that's created by the State Auditor's Office. And that is a document that I think you'll find quite useful. It's even longer than my memo, but it has short chapters on each of those type of topics. Additionally, I've provided for the board the training opportunities that are available, of which you receive certificates. They are free at no charge through the Attorney General's Office and the Municipal Research Services Center. I'd encourage you to take advantage of those. I try to take at least 2 or 3 OPMA classes a year. I've got one next week. You can constantly learn, and so I would encourage you to continue to do that as well. But with that, I'm available to try and answer any questions or follow through with obtaining additional information.
All right. Anyone
Skip,
have any questions?
Yeah, Skip, I would just a comment. Skip, I would say thank you very much for the training information and would agree that certainly ongoing, it's a prudent thing to do as a commissioner to continue to learn about that specific topic that we're discussing. So thank you very much. I appreciate it.
You're most welcome.
All right. Are there any other questions or comments from the board?
President Spikers, maybe you can refresh my memory. There probably were some questions that were asked in advance of Counsel Hauser's presentation. Can you remind me what those were?
I don't know what questions you're talking about.
Okay. That being the case, I'm still in study of the OPMA. It's a difficult document to peruse. So at this point, I don't have any particular question.
Well, if the board members have no other comments or questions, I do have a few. Counsel Hauser, the OPMA is, set up for public access, and it's sort of a fundamental right, is it not, to be able to access a public board meeting that is regularly scheduled for the public?
Absolutely. It is a fundamental right, and it's prescribed by statute to have open access to that public meeting. It also has been termed that sunshine is the best disinfectant by a Supreme Court justice, so that you want it to be open, you want it to be transparent. Unfortunately, and we found that out at the start of this evening, technology doesn't always work. Sometimes technology is not our friend, it's our foe. And so what we try to do is make it available to the public with ease of access. But unfortunately, we're not always successful. And I think what the district has done, at least since my tenure, I think I'm going on 12 years now or so, that they try to make it available, but sometimes technology does not work. And so I think they want And I would suggest you continue to do what you're doing. And today you saw examples of that. You saw more opportunities for the public to participate. You saw more opportunities for ways they can participate. And I would continue and encourage, as you said, President Spikers, it is a right and we should make it accessible and available to the greatest degree possible.
So having a live link today is a real help to achieve the intent of the OPMA. Would you say so? That'd be correct?
Absolutely.
And, you know, if we had a dead link on it, it wouldn't really necessarily promote public access to a regular board meeting now, would it? Meaning if there was a dead link that the public could not access.
Yeah, of course not. If you have a dead link that's not accessible, that doesn't promote access or transparency. Unfortunately, and I guess again, we go back to technology, you know, it is not always going to be perfect.
I have a question.
I'm not done with my question.
Oh,
So
sorry.
when I'm done with my question, you can go ahead, okay? In terms of providing access to regular board meetings, I'm just going to ask you some hypotheticals just for information only. And these informational things is just for, you know, for the board and the staff. Let's assume the district employee chose to treat a member of the public differently based on their relationship to the board member. By differently, maybe I mean like made it more difficult to obtain or be able to provide a public comment in a board meeting, a public board meeting. Would that be a problem?
Of course, Mr. Spikers. President Spikers, we would want equal and apparent access to all members. All individuals who want to access the meeting should all be treated fairly and equally. And sometimes the technology, though, doesn't treat people equal or fairly. And I can tell you right now that my technology is not nearly as good as it should be because I'm standing outside a stadium in Seattle and I don't have the same degree of ability to see everybody on these small screens that you do. So
Sure.
That's the potential problem. This technology, some people have better access than others. And
Sure.
I'm feeling that right now.
So if there was an intent to prevent this, a family member perhaps, and some kind of ill intent, are you familiar with the term targeting when analyzing the OPMA?
You know, that's one area that the OPMA has never addressed, as far as I'm aware of, targeting. As you know, that's more of a law enforcement term in terms of how they use for enforcement purposes, but I've not heard or seen any issues in terms of targeting dealing with the OPMA.
Okay.
President Spikers
Let me
is this
finish.
appropriate use of our-
Out of
no, I'd
order.
like this to
Commissioner
stop.
Carter, you had a chance. Commissioner Carter, you had a chance to ask questions. Now I'm asking some hypotheticals for informational purposes only.
Can you
It's for
take this
your
offline with
informational
Skip?
purposes only.
Maybe
Point
you
of
can take
order.
this offline. You're
Point
wasting
of
the time
order.
of 58
Point
people.
of order, Commissioner Carter. Point of order. Let me finish. Well, let's assume that only employees of a public entity were given access to a public board meeting and the public were prevented from doing that, from access. Would that be a problem?
Of course, that would be a problem because you want to have access to the public, not just employees. I can tell you at one time I tried that link and then it was many meetings ago, maybe even a year or so ago on the agenda and it didn't work. And so I called in and said, I can't get that link to work. That link did not work. I got a separate link. But again, it's technology driven sometimes. I don't see that it's individually driven, though I understand your hypothetical would suggest otherwise. I'm not aware of that. And the only thing I'm aware of is that sometimes that technology doesn't work. And then sometimes there are ways, and I know they call those workarounds.
Totally understand.
To get to
The
that.
last hypothetical I have, unless you want to continue, is allowing staff, and if according to the OPMA, if you're allowing staff and or administration to make public comments and denying a member of the public a right to make comments during a board meeting, would that be a problem?
I'm not sure I fully understand your question, but clearly if the board is denying individuals now, the statute has changed that you must allow public comment before final action is taken. It must be available to not only staff, but it'd be available to public, because the staff are public and they would have no reason to otherwise be registered or have to identify themselves other than exercising their opportunity to make public comment. Just as any other public member, whether they live in your district or not, they would have access to that meeting and that opportunity to make a comment.
If the board denied a public access or public comment to a member of the public during a time period when public comments were being made by staff and employees only, would that be a problem?
Apparently so. Again, these are all very fact-driven and fact-specific. And as you know, with your legal background, as you know, they can all be very fact-specific. But hypothetically speaking, if the board chose to allow some individuals opportunities to speak at an open public meeting and others not, that would be inappropriate.
Thank you. Those are the only questions I had. Thank you anyone else have any comments or questions?
I have a question relative to public comment. Let's say, for example, the president or the CEO felt that a commenter was going off board a little bit, perhaps saying things that were inflammatory. What is the role of the president at that point if he or she has made that determination?
The OPMA is fairly precise as to if there is a disruption occurring in the meeting, the presiding officer, which in your case would be your president, could adjourn the meeting and then remove to another site or location, so long as the press, if there is any, is allowed to go with them. Unless the press was part of the disrupting behavior, then the press would be excluded as well. You would then remove the board to another location or room and continue to hold the meeting without the public based on that disturbance. And that is provided by the OPMA.
So I'm just this may be hypothetical too, but it is applicable. How do we determine what is disruptive?
That is a very good question. Justice Potter Stewart said, as to pornography, I don't know what it is, but I know it when I see it. And so what is disruptive? I'm not sure I know, but I might know it when I see it. I've had one board where a commissioner assaulted another. I did an investigation for one board where a commissioner hit another with a coffee cup. And so I clearly saw those as being disruptive. But again, we'd have to know it when we saw it. And I would trust that your presiding officer, President Spikers, would be able to deal with it if it occurred.
Well, I'm very happy to say that no one's been hit by a coffee cup.
And I'm very happy as well.
All right.
Question.
Yes, Commissioner Herron?
Would it be appropriate to say that open public meeting is not designed to provide a forum for those who are venting out that may be constituted with a personal attacks, complaints, or employment procedure, or employment reasons? Would it be appropriate to say that the forum for this open public meeting is designed to hear updates, to educate the public and to get information and all that, and not a special forum designed for that? Is that correct? I mean,
well, Commissioner Herron, I would agree with your premise that the meeting is designed to provide information and opportunities for the board as well as the public to share their concerns and to do updates. But again, the beauty is in the eye of the beholder as to the comments that are being made. Individuals who are addressing the board may have a difference of opinion or a different approach or different syntax to put into context. And therefore, I can't, without seeing a specific example, tell you as to whether or not it would be inappropriate. Again, that would be the presiding president, Mr. Sparkers, finding out whether or not his belief is to it's being disruptive. If it's disruptive, then he stops the meeting. If it's not, he makes that determination. But each of us that appear before this board have a First Amendment right, a constitutionally protected right of freedom of speech. And that is really hard to define at times at will.
Okay, thank you.
Is it my understanding that freedom of speech is only as it relates to the government, not necessarily a private entity?
I'm not sure I understand your question, but freedom of speech pertains to private entities as well as the public. You have a right to speak privately about any private entity or the public. You're entitled to your opinion. Speak that opinion again, so long as it doesn't incite a riot or incite others to do others inappropriately or put them at risk or danger, like yelling fire in a crowded movie theater or at your public meeting.
I think we're getting a little off topic of the OPMA. I'm sure we would have a full day on the First Amendment and decorum in on a board meeting, and maybe we could do that in the future. Does anyone else have any other comments?
I'd be happy to help with that.
I know you would, and we may call upon you. So
okay, thanks, Mr. President.
All right. Any other comments related to the OPMA? All right. Patient story. I want to hear it. Tricia Ralston, you're on.
Thank you, President Spikers. Good evening, everybody. I have the wonderful opportunity of always talking about our culture, our staff, and patients, and how they commend the care that goes on here, which is always a really fun part of this meeting for me anyway, hopefully for all of you. Really appreciate the comments tonight and last meeting and the support for CEO Jensen and the executive team, and just highlighting the culture that we have here. So today's patient story, I have two actually. One is one that came through via our Feed Trail system, which is our patient satisfaction. And that is, having personal medical experience, my expectations are extremely high. Your hospital exceeded every single one of them. Every single staff member that I encountered was kind, courteous, and helpful. There was clear communication at all times, and they were always there to help. I would also like to recognize the housekeeping team. Their attention to detail blew me away, and I noticed and really appreciated how they do not use the same rags and mop heads in the bathroom and patient rooms. The cleanliness was stellar. I don't think I would have gotten this level of care in my home state. I really honestly cannot commend your staff enough. Just highlighting, honestly, throughout this building, there is just a team effort to provide amazing care in every corner of this building. And so my other one is written by one of our therapy team. Lisa, our director of therapies and wellness, sent me some fun numbers. Last February in 2025, we saw 41 pediatric patients. And in February of 2026, we saw 121 pediatric patients. So that population within our therapy team is growing, which is amazing. And so this story from one of the therapists, I have a patient with autism who is nonverbal. She uses a special device to communicate, but until recently, she would only use the device at school. Without the device, her parents were unable to meaningfully communicate with her. After working with the patient, she has now mastered over 50 words on the device and even used it to spontaneously say, "I want a granola bar, please," during our session. Her favorite activity during therapy is to sing with me. I sing the song and then pause so she can fill in the animal name and sounds the animal makes. She even tries really hard to time her answers with the tempo. It really is fascinating to see her combine the use of the device with her enjoyment of music. I thought that was a beautiful story to share with everybody.
That was.
Thank you.
Thank you. Thank you, Tricia Ralston. We are up next for commissioner business. State Auditor's Office Exit Conference, information only. All right, who's going to be speaking about that?
Yeah, Commissioner Spikers, the state auditor's office should be joining shortly. There's Haji right there. I can see him, and so they will be presenting the exit conference to the board.
Yes, and we have Carmen Law as well. Okay, I can see the slides. All right, I will go ahead and get us started. So good evening, everybody. Yes, so we're here today to share the results of the district's most recent audit. My name is Haji Adams. I'm the audit manager. I'm with Carmen Law, who was the lead on the audit, and then Elisa Kim was the supervisor on the audit. And then today's presentation is going to be a summary of the audit results. And to supplement the presentation, we have provided a packet of information that includes the copies of the draft audit report that will be issued, and then the exit conference agenda for today as well. Let me go on to the next slide. All right. So one of the most important things about audits is their role in increasing trust in your district. So an audit lets you, staff, and others, such as the public, know if areas of operations are working properly or if there's any improvements that can be made in the areas that we review and examine. And also having that third-party independent audit is important and increases the public's trust that the information presented by the district can be relied upon. It also gives you all assurance that the numbers presented in the financial statements are accurate and can be relied upon as well. That the district's in compliance with state laws, rules, regulations, its own policies, procedures, and then also safeguarding of public resources. And the results are available to the public and then published on our website. And then last but not least, audits are designed to help you improve operations. So if there are any audit recommendations, they are made to assist the district in continuing to improve its efficiency and then effectiveness as well of its operations. So with that, I'll hand it over to Carmen to go over the results.
Thanks, Haji. So for your district, we conducted an accountability audit that covered the period of January 1st, 2024 through December 31st, 2024. The purpose of an accountability audit is to ascertain whether the districts comply with state laws, regulations, contracts, grants agreements, and its own policies and procedures. In addition, these audits also look at whether, in general, the district has adequate controls to safeguard public funds. Under the heading Results in a Brief, you will see that our audit found that the district operations complied in all material respects with applicable state laws, regulations, and its own policies, and provided adequate controls over the safeguarding of public resources. For your reference, these results can be detailed on page 7 of your packet. Keeping in mind, we do not examine every transaction, activity, policy, internal control, or area. As a result, no information is provided on areas that were not examined. Next slide, please. So on this page, we have a summary of all the areas we looked at for accountability audit. So our first area is the procurement of public works, specifically to the medical office building. We reviewed procurement documents to ensure compliance with competitive bidding requirements for public work projects. We also reviewed the overtime payments for payroll. We gained an understanding of controls, reviewed internal policies, and tested overtime payments to ensure overtime is properly reviewed, approved, and accurately calculated. For accounts payable, we reviewed electronic fund transfers, specifically the controls for vendor payments to ensure electronic fund transfer disbursements are adequately safeguarded. And then we also reviewed credit cards, where we gained an understanding of controlled and reviewed transactions for credit card payments to ensure they were allowable, approved, and adequately supported. For accounts receivable, we reviewed the compliance of the charity care policy, where we gained an understanding of the charity care program and the application process. We tested both approved and denied applications to ensure applicants who were approved received the correct discount amount, and it was provided in adherence to state laws and the district's own policies. We also reviewed open public meeting minutes, where we reviewed the meeting minutes for the compliance with minutes, meetings, and executive session requirements. And then our final area is financial condition, where we reviewed for any indications of financial distress. Our office also has an online financial intelligence tool, also known as the FIT tool. FIT has yours and every other district's financial data as submitted to us in your annual report each year and transforms that data into an easy to understand measure. This data, all being in one place online, allows you to explore your district and compare it to other hospital districts throughout the state. For example, on this slide, we have the financial health of all 61 hospital districts that submitted data for fiscal year 24. Next slide. Shown on this slide are the FIT results for your government. It's important to note that having a particular financial health outlook in the FIT tool does not necessarily indicate financial stability or stress. Indicators are designed to alert viewers to potential financial health concerns by comparing the ratios to our recommended thresholds. We also wanted to note that the cash balance sufficiency is shown cautionary. However, the district is above our recommended threshold, and it was only flagged due to the downward trend. Next slide, please. We also completed a review of the independent CPA firm audit for the financial audit that was completed for fiscal year 24, and we noted no issues there. And then I'm going to pass it back to Haji for closing remarks.
All right, thank you, Carmen. So we're pleased to report that the cost of our engagement is expected to be within the estimate that we provided at the beginning of the audit. And then the next scheduled audit will start fall of 2026. It'll be an accountability audit and then also a CPA financial audit review as well. We've also provided an estimated cost for the next audit in your exit packet for you all as a budgeting tool as well. You go on to the next slide. So our audit reports are published on our website. We expect the report to be published in about a week or two from today. We've also provided a link that you can use to sign up to be notified by email when the audit reports are published on our website. And you can also use that to sign up for any news articles or alerts as well from our office. And you'll also receive an email notification when the reports are released, and we've provided some instructions as well on how to locate the reports on our website. Then we'll also be sending you a customer service survey. So we just ask that you please provide us some feedback, as it helps us improve our services and also know how we can better meet your needs as well. And I'll hand it back to Carmen for some last remarks here.
Yeah, so I would like to thank Shauna DePrado, the Finance Director / Controller, and the district staff for their timely responses to our requests during our audit, resulting in an efficient audit. And then last slide. This concludes our presentation on the district's accountability audit for fiscal year 2024. We would like to thank everyone for your time today and your participation in this meeting. If you have any questions after today's meeting, our contact information is provided on page 3 of the packet. At this point, we would like to open it up for any comments or questions.
I have a question.
Yes.
When you're doing the audit,
Commissioner Herron, or is that you? I just want to know who that is. That's all.
I'm sorry, Commissioner Herron.
Okay, thank you.
Thank you. I have a question that do you also on your audit, do you include reviewing monthly, yearly ledgers for comparison to our provided by our financial CFOs?
So we do not conduct the financial statement audit. So that's done by the CPA firm. So we do review their audit that they conducted though.
Okay. Is it also a requirement that all executive finance directors and officers establish credentials of their profession? Is there like a license certification involved as well?
I'm not aware of any. I don't know the particular instance you're speaking of, but not that I'm aware of.
Does a higher finance, does for example, a CFO, finance director, are they required to be CPAs or accountants certified?
So a finance director doesn't have to be CPA certified. No.
How about a CFO? Do they have to be CPA certified? Or, well, that is certified public accountants. Do they have to be a CPA?
They don't necessarily have to have a CPA. No.
We do have a CPA on our team, though.
We have 3.
Yeah, okay, I knew we had at least one. Okay, okay. So just to lay that to rest. Okay.
Okay, thank you.
Yeah.
You're welcome.
Nice tries.
Okay. Well, I just wanted to say thank you for your time today.
All right.
Thank you, Haji.
All
We
right.
appreciate it. You guys are great to work with. So thank you.
You're welcome.
Thank
All
you
right,
for
have a
all
good
your
rest of the
work.
day. You're welcome.
All right, thank you.
All right. Thank you.
Thank you very much, Lori.
Okay, under Commissioner Business C, the 2026 Quality Plan, Director Rudberg.
Hello, good evening, everyone. I think we're going to bring up the presentation here. Do we want to skip directly to C, or are we going to start with B?
Well, I thought we have the quality plan.
Yeah.
And we should have the quality report first, I thought, but I don't know. Either
Yeah,
one.
no, there's a compliance report, a quality plan, and then a quality report. So
Ken, the time is yours to use whichever order is best for you and for the commissioners. So it was just a guideline. If it's out of order, feel free to do it however it fits best.
Okay, perfect. So for those of you who haven't met me, my name's Ken Rudberg. I'm the Director of Quality, Risk, and Compliance here at Snoqualmie Valley. I've been with the organization about 6 months now, and this is a great opportunity for me to talk about the compliance program and the quality program, which I oversee. So I wanted to start out with a compliance update. This is a list of some of the topics that the Compliance Committee talk about on a regular basis. So I just wanted to give you an update on some of the things that have been happening over the last year. So one of the things we review is the regulatory activity. So this is any licensing or outside agencies that license us, that come in and review us for the care that we provide. And kind of the big news on this issue is we had the Department of Health come in for our every 18-month licensing survey in December. And so they were here for 2.5 days. There were 3 auditors, and they really looked at our organization from all angles, including going to our units, seeing how our staff worked, speaking with our staff, looking at the facilities. And it was a very detailed audit. And I'm happy to report that we had a great audit. We were able to get through that audit with very few findings compared to other surveys we've had. So this is the least amount of findings we've had, which we were able to put in a plan of correction and have that accepted, and our licensing renewed for another 18 months. So that went really well, and they highlighted a few areas, including our environmental services staff and our staff that works in the endoscopy suite for how clean and how great we are at sterilizing our instruments and things like that. So overall, I thought it was a great survey, and we're set to go for another 18 months there. Another area that we review is privacy issues, especially related to HIPAA violations, which inevitably happen at healthcare facilities. We review each of those to make sure that we inform patients where we are required to, and we review how they happened and put in things so that we can make sure they don't happen again. And then at the end of the year, we have to submit our list of violations to CMS so that they can have that list. And so we make sure we review those and have those submitted, which we have done recently. We also have a compliance risk assessment, which is done using a tool from the Office of the Inspector General. And it really has a list of all of the things that we're concerned about that changes regularly. So we update it frequently. And then each risk has a numerical value assigned for how frequently it might occur versus how severe it would be if it should occur, and kind of multiply those numbers together to give us a relative risk for each of those risks so that we can understand where best to put our prevention efforts in place. And that's kind of a living document that is continually being updated as our risk environment changes over time. We have a compliance plan which outlines our compliance program, how we operate it, who's involved with that, and the meetings, for instance. And that plan needs to be reviewed once a year, and it's attached to this document for your review, although it doesn't need to be voted on. It's kind of a continuation of the plan from last year. No changes, and we're looking at it for anything that might have changed since last year, but this year we haven't made any changes, and it's going to remain the same. The compliance reporting is really important. It's a key part of the compliance program. It allows outside people from the public or staff or really anyone who has a concern about any compliance issue, whether that's billing or something else related to compliance, they can have access to an anonymous phone line and email address so that they can make those concerns known. And although those are very rare that we receive those, we make sure to review those at all of our meetings as well. And then the last is really looking at changes to the laws and making sure that we're staying in compliance with things as they evolve. An example of this is the workplace violence program. The law recently changed to require increased reporting for that, and making sure that when our staff are hurt during the course of their job, that we're investigating how we could prevent that from happening in the future and reporting those numbers out on a regular basis. So those are the general buckets of work that we work with on the compliance committee. There are other things involved, but we want to make sure that people know what we're focused on and have a listing of what we've done over the last year. So are there any comments or questions on this before I move on to the quality review for last year?
Just for the board's awareness, the compliance officer needs to have direct access to the board. And so this is one way that we provide that, is for Ken to be able to get this report directly to you and allow you to ask him any questions.
Great, thank you.
I appreciate all the details.
Thank you. However, I know this is a quarterly, and two commissioners are members of the board of the committee. And I just wanted to ask Director Rodberg whether this report was taken from last year and from the meeting that is supposed to have taken place the first quarter, which is March.
This meeting is a fourth quarter, or this report is for quarter one. And so it really entails a summary of what happened in 2025. And so the meetings that you had attended last year are kind of wrapped up in this kind of annual review of last year.
There was also a discussion planned for the January meeting that never happened. And so I asked Ken to come back and present this to the board because it got skipped over earlier.
Oh, okay, because we, the two board sitting on the quality, was never informed. So just for the record, we would like to request a date. I know we meet every, to be added to our Board of Commissioners calendar, please.
Okay, yeah, and happy to have all of those lined up. And I believe you'll be at the next quarterly quality meeting, which happens next month.
Okay, thank you.
Thank you.
Yeah. Okay, so I'll get through this fairly quickly. The patient satisfaction trends are a key element that we look at during the quality review. We want to make sure that our patients are happy with the care we're providing. And I think the comments that Tricia Ralston spoke about earlier show that for the most part they are. One of the things that we really like to focus on is this chart that I have here for the likelihood to recommend comments. So this is a key comment that we send to all of our patients when they get their patient satisfaction survey. And it's in response to the question, how likely are you to recommend Snoqualmie Valley to your family and friends? It's ranked on a scale from 1 being very unlikely to 10 being very likely. And a top box is if you pick a 9 or a 10 on that scale, And as you can see here, our goal is that 90% of our patients pick one of those 2 boxes, and our score has been consistently above that throughout 2025. The most recent data that we have in the most recent month, 95.3% of our patients picked that box, which is a really stellar level of satisfaction with our services. But we don't just look at that. We review all of the individual questions, look for any trends to make sure that we're not dropping off in areas where we have concerns. And we're also looking at every patient comment that we get, categorizing them into positive and negative, and making sure that any negative comments are responded to and that we're able to address those. We also
Ken, before you move on,
Sure.
let's take a breath and pause and celebrate. These are the most amazing patient satisfaction scores on the planet. This is our staff should be commended for this. Yeah, I agree. Thank you. This is a direct result of the amazing culture and the great team that we have that makes this patient satisfaction this high. I've never seen this at any organization I've ever worked for. So kudos to all of our staff.
Thanks for pointing that out, Renee.
Great. Perfect. So why don't you move to the next slide? Thanks, Jennifer. Great. And so this is an update on the policy and procedures that were being developed over time. We had a lot of policies that were awaiting action at the beginning of 2025. So that means they were due for revision or they needed to be reviewed. And due to a lot of hard work by a lot of people, including managers who own these policies, that work happened over 2025, and they were able to reduce the number of policies needing action from just under 400 to 150. And as of the most recent data, we're under 100. And this is despite new policies coming up for review all throughout the year, so that we're kind of swimming against the stream here. And really making sure that policies are consolidated where they can be, or eliminated if we don't need them, and making sure that the policies that are important are reviewed in detail so that we can make sure we're providing safe and effective care for our patients.
Yeah, I'm not quite understanding, because I bet there's a lot more significance to this chart that you put up than I understand. Policies awaiting action. I see the 7 or 8 policy points, I believe. What does that mean from under 400 to 150?
Yeah.
Can you kind of give us a layperson's perspective on that, please?
Sure. And so we have hundreds of policies here, all the way from really broad policies outlining how we disinfect things, all the way down to very small details about how we handle a patient transfer. And so these policies need to be reviewed on a regular basis. And as they come up for review, someone has to go through them in detail, and they sometimes need to be taken to in front of the other people who are going to need to approve them. And so meetings have to happen to discuss, have changes needed to happen. And so all of these need to be reviewed on a regular basis. And so there was a backlog of policies that needed to be reviewed, and that backlog has dropped down from 400 policies needing to be reviewed to less than 100. And so
that's good, right? That's great, right?
That is great.
So what's the average amount of policies that are awaiting review on a normal basis? You may not know because you've only been here for 6 months, but maybe Renee, you could chime in on that.
I was actually going to let Trish, because she is the executive sponsor for this work.
There's about 800-900 policies in total, and it has been a great passion of mine, as my team knows, that we across the organization are working on consolidating, adding policies when needed, or consolidating to get rid of some. And so on average is not something I want to actually speak to right now, because you can see the decline. My hope is that give us another couple of months and we're just going to be on a monthly rotating of maybe between 50 that are outdated while folks work through them and update them to be most current.
I think some of the other important part of this work was just historically, it seemed like there was a policy on everything prior to me coming, and we were trying to make a differentiation between a policy and a procedure and a work tool. And so it's very, very different. And so we're trying to really just make the policies policies and then differentiate those that are just job aids and procedures.
That gives me a much better idea. Thank you. And thank you, Tricia.
Yeah, and thanks Ken and the rest of the SVH team on this one. They've done great work. Thank you.
Great. Okay, the next bullet we've talked about already in the compliance section, talking about regulatory survey activity. And so not just being ready for the Department of Health, but there's lots of other regulatory activity that happens around places like the pharmacy and the lab. And so making sure we're ready for when they come. There's also something called apparent cause analysis that we've introduced. I think a lot of people are familiar with root cause analysis, which is when there is a serious safety event that happens. It's a very rigorous and detailed process where teams get together to discuss how that happened, how we could prevent it from happening again. And it is a very large amount of resource that goes into that, as it should, because it's responding to a critical event. But there's a kind of lower level apparent cause analysis that doesn't take as many resources. And we've been introducing that for less serious events, but still things that we want to make sure don't occur again or don't happen and become a serious safety event. And so we've been rolling this out for a few of our events that are kind of above the level of just a regular quality project, but not rising to the level of a root cause analysis. And I think it's really helped add some rigor around how we address events and make sure they don't happen again. Process mapping. This is around processes. As you know, we have a lot of complex processes in the organization that touch a lot of different areas. And a lot of times departments will have a piece of that process, but they won't understand the whole process. And it makes it really hard and for communication's sake, and it's really difficult to improve a process if the teammates that are part of it don't completely understand it. So really just getting people in the room that are part of that process to discuss it, map it out so that everyone's on the same page with, oh, this is our part of it, but I can see why further down the line, this could cause a problem, what we're doing. So how can we make that better? And so really serving as a baseline for improvement. And with all of the complex processes we have and more processes that we're going to have to build going into the hub, I think this is a great time to get some of these processes on paper so we all are clearer. We've also worked really hard on QI education, empowering frontline teams to do quality improvement projects. If you go to the next slide, there's some information on a cardiac rhythm identification training that was identified as a potential project. And we were able to do some training and get some of our staff who asked for additional training on the cardiac rhythm identification trained, and they were able to have a kind of a evaluation before and after, and we're able to make really good strides on that. And that was identified as a project that a team could work on to get better at a departmental level. And not every quality improvement project has to be top down. It can be from the staff that are at the front line that want to make an improvement, and how can we empower them to do that. And then the last, safe patient handling, is really about the subcommittees of the overall quality committee that are doing more specialized work. Lisa Childress, our rehabilitation manager, heads this committee and has done some great work on making sure that our patients are transported safely throughout the organization, and reports up to the quality committee every month to talk about the work that they're doing. And we have other teams that are doing that as well. And so we're really trying to kind of have it roll up from the front line to the committees, to the quality committee, to the board, and have that kind of clear line of quality being important all the way from the bottom to the top. So that was the quality review. We'll move into the quality plan here. If are there any questions on the quality work we've been doing? Okay, the quality plan is similar to the compliance plan in that it outlines the quality program. It talks about the quality committee structure and the reporting. what my role is in the quality work, the kinds of quality tools that we use, but the quality plan needs to be approved by the board every year. The document that was attached here is for the most part the same as the document last year. There were a few minor changes for language, and the committee structure changed a little bit as well, just to make it more accurate with what is actually occurring right now. And then the only substantial change is that we added a section which is part of the Appendix A, which outlines 2026 priorities for quality. I think a quality plan should outline what the goals are of the organization as far as quality goals for that year. And so we have worked in the quality committee to talk about areas that should be a focus for the year. I think this year we're really focused on making sure we're safe going into the hub. And so the things that have come out on that plan include medication administration. We want to make sure we're doing that in the best way possible at the current building, so that when we move to the new building, there are new processes, a lot of new people, and new spaces, that we have that as down as we can, so we don't have any concerns about the way medications are being delivered. We had a roundtable discussion at the quality committee, and people had raised that we're going to have a lot of new processes over at the hub that we don't have here. We're going to be doing new service lines, and we want to make sure that we have processes and workflows in place that are not only safe, but they work well with other processes that are going to kind of be overlapping in the same way that we talked about process mapping earlier. And so how can we get the requisite number of critical policies ready to go, or critical workflows ready to go before we go over to the hub? So that was the second. And then the third, I think, is just foundational to patient safety, which is infection prevention. How do we make sure our hand hygiene is as good as it can be now before we hit the stress of the new environment? And so those are the three that have been called out. And they're in the appendix, along with a section outlining the new policy for having quality goals for the year. So that being said, President Spikers, is this appropriate to call for a vote on this plan? It
would be. I think you've laid it out very well, the review as well as the plan. Does anyone have any questions maybe before we, or should I just go ahead and call a vote? Make a motion, someone make a motion to adopt the plan, the quality plan for 2026. And we'll have discussion, I guess, if we get a second.
I second.
Okay, we have a second. Do we have any discussion on the quality plan of 2026?
I'd just
Did you
like
make
to
it
add,
first, David?
The two people are speaking at the same time. What was that?
David, did you make
Commissioner
the
Haugley, go ahead.
Thank you, Commissioner Spikers. Did you make the first?
No,
Did you make the
I
motion?
believe someone did. I thought it was Commissioner Herron.
No, it was Commissioner Bowers.
yes,
Oh,
I
good.
would move
Oh,
that.
okay. Commissioner Bowers made a first and second. Now we're
I
ready.
second that motion.
Okay, now is there any discussion?
I have more of a comment. As a 40-year provider of healthcare, I think this is probably one of the most in-depth and widest quality plans I think I've ever been encountered with. I'm really excited to work with you in the future on this. And as a provider, I look at these things. I look at patient satisfaction. I look at infection control, patient flow, and things of those sort. And I have every confidence that you're going to do a great job with this.
Thank you.
Commissioner Bowers, I thank you so much for that comment. Ken has been an amazing addition to our team. He has really improved the quality of our quality committee and quality across the hospital, and we really appreciate his hard work.
Yeah.
Also, just want to add thanks for that, Commissioner Bowers, as well. Wanted to let you know the meeting for the commissioners was January 20th. And so that was just pre you taking on the official position. And so we do have you teed up with Commissioner Herron to be at the April meeting. So just wanted to clarify that for you.
I have no concern about that.
Awesome. Thank you.
All right, with that in mind, are there any other comments or questions for Ken? Or about the proposed plan? Hearing none, I'm going to ask for a vote. All in favor of the 2026 quality plan, say aye.
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 Enthusiastically aye.
Okay, that's a 5-0 pass. Thank you, Ken, for your wonderful presentation.
Thank you.
Great job,
Appreciate
Ken.
it.
Thank you.
Nice job.
Thank you,
Okay.
Ken.
We are now in reports. The CEO report, CEO Jensen.
All right, I've got some good stuff for you tonight. Obviously you received the report, but a few things to add to this. I'm just going to start in the beginning with the foundational buckets and organize my comments by the strategic plan. So first and foremost on here, a shout out to Steve Wright, who is the director for our foundation. This is a really busy season. So not only is he getting ready to prepare to do the champagne brunch, which I hope you all have bought your tickets and are coming to support, Commissioner Carter has graciously agreed to MC the program for us. So if not, you just come to watch her and her magic. We appreciate it. Thank you. So May 1st, so Steve is getting ready for that, but he's also in the midst of getting doing the capital campaign. Right now, the capital campaign, that's a lot of the boots on the ground, the grass work, behind the scenes things that are happening that will come to a culmination as we get closer and closer to the hub. So he's trying to do 2 extremely large tasks right now. And I just want to say thank you to Steve for all of his work. We're seeing lots of community members start to come out and support the foundation and wanting to get involved and being on that capital campaign committee. So it's a very, very good sign. We appreciate that. Under operational performance, I wanted to shout out to this. So this may not seem like a big deal, but as you know, we have a very comprehensive plan and pro forma and feasibility study that determine whether or not the hub will be successful. So that means now we have to execute that plan. Part of that plan was bringing on some of our great providers. We have new specialists. A couple of them are joining the board meeting tonight. But we were taking a look at how long it was taking patients to get appointments, and that kind of, you digged a little bit deeper, peeled the onion back, and we realized that there was a huge backlog in our referrals. And so Will Pand and Lauren Watkins kind of dug in and were helping out to figure out what the problem was. And the funny thing is they had asked for an FTE for this department, and it was going through the process like it normally does, but they didn't shout out and raise their hands really high and say, no, we need it now. We can't wait. And so what we found was we were understaffed by about 2 people in this department. And through the great work of not just adding, even before we got the new people on board, they went through the processes, determined like, how could we remove barriers for these referrals, like ones that didn't actually need referrals, we could just do direct scheduling. And in my report here, I said over a 4-day period, 524 referrals were completed, while 334 new referrals were added. And so not only is this a huge net decrease of about 2,200 referrals in 4 days, but I want to just shout out 334 new referrals. That means the work that the marketing team and Kelly Bender, our outreach manager, are doing is working. These are not all internal referrals. Many of these are external referrals as well. And so we need those referrals to get our specialists busy, and getting our specialists busy means that we can have a successful hub with our practices being full. So we're just really excited about that work. In addition, a monumental landmark milestone for the district. We had in one day, I don't know why if it's related to St. Patrick's Day, but 191 visits in our clinic in one day. That is the most in the history of the district. So very impressive. That takes coordinations from our MAs, our providers, the nurses, you name it. Everybody has to be all hands on deck to see that many patients in a day smartly. So thank you to our teams doing that. So with that said, we are proud to say that our specialists are ramping as expected. Their practices are getting fuller. They're seeing more patients, and we believe they're on target with our plan. So we're excited about that. And thank you to all their hard work for everything they do. Also in our marketing and outreach, this team is keeping me extremely busy. I am exhausted, but I love it. And we mentioned at the last meeting, Commissioner Bowers had joined us for the Carnation City Council meeting. There's a great photo of him in the CEO report. But also we did the Snoqualmie Valley Chamber, had about 80 members this week that were present for that presentation, and they gave me extra time. So we got to share extra amount of stuff about the hub, which was exciting. And we also were invited and were presented for the North Bend City Council. So shout out to Mayor Miller for her hospitality and having us at the City Council meeting and being able to share with the North Bend community. So it's just been, this is that we call it the Hub Roadshow. We're not only talking about our new services and talking about our new specialists, but we're about what's to come, the why behind the Hub, the reason that it's here, and how it is supporting the growth and the well-being of this community. The outreach team is also very busy. They did we're going to do the tribal health fair, but I think the flood may have canceled that, but they were ready on deck to go. They did a great careers event and Mountainside School Health Career Fair. So that is great. And then shout out to Dr. Rappaport and Dr. Yoshida for the Skyline High School, and they went to speak to students about surgical careers and what it means to be a surgeon. So I thought that was pretty cool, like to actually get a surgeon to come to your school and talk to your high school students. So shout out to those guys for their work and getting out in the community. We also had another milestone this past week. We are at a parking space. We have no parking there. We are so full and so busy. There was nowhere to park. And this was not because a construction crew was parked there. They have their own parking, but we actually had to go out and move staff vehicles out to the road and kind of make sure everybody was in the back to create some additional parking spaces for our patients, which is a really good problem to have. Let's see. We're also getting another thing. I know Robert Agarsano was on. I'm not sure if he still is. He's a member of our finance committee, but he always likes to bring the information about EMS and transports. We are seeing record numbers of admits from our emergency department to our medical floor. And that is great for our EMS partners because it means they're doing less transfers and that they can bring more patients to us and not worry that they're going to have to turn around and then take that patient to another facility. So great work by Abby Wallen and our ED nurses and the team there. All right, moving on to health system of choice. Again, Ken, I can't top that graph. That is an amazing graph that speaks volumes of how much patients really do appreciate coming here. But the other thing that is really telling, and Commissioner Carter, you will appreciate this, social media is something that we always watch, and we are interested in the comments that are happening there. Snoqualmie is very, very used to using social media as a way to communicate as a community. And they'll tell you everything that's on their mind, good, bad, or indifferent. And we have been seeing some awesome feedback about our swing bed program and our nursing staff and the care that people are receiving here. I think somebody had posted about, like, you know, where should you go, or have you had any experience? And you can see the comments that and the replies that are there in my CEO report. That warms my heart because that's unfiltered and that's just raw data coming back to us about the great care that people are receiving here. So good stuff there. So our medical floor, a shout out to all the hard work and the great teams that are there. I had the privilege of rounding up there today, and just a quick stop in and a visit to talk with the staff. And you know, usually like, oh gosh, you know, why didn't you tell us we were coming? We would thought of something else to say. I'm like, I don't want you to think of it to say. I want you to tell me what's on your mind. And they said, oh my gosh, today is a great day. It's amazing. I'm like, isn't every day a great day? And like, today is amazing because we were working with some of our OG staff members, and we really appreciate working with them, and things are going well, even though we're busy. And it really warmed my heart because they were willing to share, and they were so happy about the culture and the great teamwork that they have up there. So I want to shout out to Nicole Reed and Heather Paris, our nursing leaders up there. They have done a fabulous job. It's because of them that we have one of the lowest nurse vacancy rates that Snoqualmie Health has ever seen. It's incredible. We have very few open positions, and we're using, I think, hardly any of our agency staff for nurse positions. So just excellent job to that team, and congratulations. Also today, we talk about our Leadership Rocks program. I was able to award Rachel Hart, or actually I shouldn't take credit. Sorry, Shauna. Shauna, I got to escort Shauna up to the floor, and Shauna gave away a rock to Rachel Hart today. Rachel Hart is the person that is the core of our scheduling. She wrangles, I can't even tell you how many nurses. Trish might know. There's a lot of nurses, but she has to make sure everybody is scheduled. When there's vacancies, people are coming in. We have to do the PRNs, and just it's a magical dance. She has had the most accuracy and best time cards across the entire, with the fewest exceptions across the entire organization. And I'll tell you, I only have about a dozen to do, and she beats me. She makes me look bad. So I just shout out to Rachel. She is amazing. And Shauna, she was well deserving of your rock. We highlighted the Bold Awards again in the report. I just can't say enough about this great staff. And so thank you for all of your support for the work that they're doing. I really appreciate it. Also, under our people category, David joined me for the MEC meeting today, and I gave an update on our CMO recruitment process. We are getting a lot of candidates, and so we're reviewing a lot. We are interviewing some by video, kind of a screening call, and then some on site with the executive team. And then if there was anybody successful from there, they would move on to the medical staff interviews. We, at this point, have one more candidate. We did one last week on site. We have another one coming this week, and we have one more video screen to do, and hopeful that will be an on-site video recruitment as well. So just coming along great. But in the meantime, we're doing fine. We got this. Between Trish and I and Tammy and Dr. Shaw, shout out to her, we're doing good. We're keeping our noses above water barely, but through the support of the great medical staff, they've given us the gift of time and allowing us to be able to have a patient and thoughtful recruitment for this position. So thank you to Dr. Shaw and the rest of the medical staff for their help and support. And the hub construction update. I know you guys wanted to know about this, but if you have questions about the hub, this is your chance. This is a great opportunity for you to learn more of things you want to know about. We are on budget, on time, and doing well. That's the bottom line, and I'll go backwards from there. We had our leadership team, we do a lot of education with them. We do a lot of intensive leadership team meetings, generally one a week. And so once in a while, we have a team meeting that we call Have More Fun. So today was the Have More Fun leadership team meeting, and GLY graciously accepted 27 of our leaders on site at the hub in hard hats and boots and jeans and vests. And they got to tour the site for the very first time to see their departments and be able to really see what's coming to life from the paper and the drawings that they've been doing and the creations that they've been and the renditions they've been doing in their head. They could actually see it in steel and concrete. And my favorite part, I think hopefully Kelly Miller is on tonight. A shout out to her. She is the most detail-oriented, greenest person on our entire team. She walks in and she looks at these rough, tough construction guys and she goes, "You got it wrong. My wall is not right." And she knew, because she knows those drawings so well and the department so intimately, that she knew they had built a wall wrong. And they looked at it and they're like, "Oh, you're right. It isn't right." And so that it was a great catch. So it was great that the people that are closest to this work are getting an opportunity to actually see it being built so that we can fix problems upstream and real time and not cause any delays or cost impacts to the project. So shout out to Kelly Miller and all her great detail orientedness. Love it.
For the record, I'm jealous.
Don't worry, there will be more. There will be more. This was just a quick sneak peek, and we snuck them in after hours this afternoon after the crew went home. So it was the construction superintendent's birthday today, and so he stayed late even on his birthday to allow them to go. So you guys share a birthday, Kevin. Something else the commissioners are probably interested in is we are still working with the city of Snoqualmie on the sewer lift station. And they had it out for bid, and the bids came back surprisingly not anywhere near where they thought they were going to be compared to their estimates. And so there's something not quite right there, and the city's going to send it out for rebid. So we're close communications with them. A shout out to Mayor Mayhew, who's been wonderful support of this project and helping remove barriers and making sure things are going quickly. We have a meeting set up with the city later in April, and that will be a coordination of when do we go live. And so it seemed like you look behind me at the photo and you're like, we're talking about going live already. Yep, we're talking about going live already. And so that'll be really a delicate balance and kind of almost a ballet and a dance between the contractors, the architects, the owners, us, and the city to say, when can we stage equipment and when can we get in? And so right now we're looking at like December to February. Now it seems like a big time period, but there's a lot of moving parts to that and a lot of coordination that needs to happen with the city. So we're looking forward to working with them, and they've just been wonderful partners and they understand the urgency of the project. So it's been fantastic. I'm not going to share anything out of the financials because Patrick's going to cover that, but I will open it up for any questions you have about anything else or specifically anything else you want to know about the hub project.
Point of order, Mr. President.
Yes, go ahead, Commissioner Herron.
I see that we went through the reports, but we have not finished our commissioner business. We have on our agenda Resolution 7280326, authorizing and approving the amendment and restated bylaws. And
yes, I
that
can
is on
speak
our
to that.
agenda. So
I could-
let's finish our commissioner business first.
Well,
Thank you.
Thank you, Commissioner Herron, for pointing that out. But at late notice, I think you were given an amended agenda based on some issues, legal issues with some of the amendments. I chose to void that, or to I don't want to say vacate, strike it from the agenda. I'm sorry, strike it from the agenda. And the reason being, there was just too many things. And then after I did, Commissioner Carter or Commissioner Bowers sent me in a note saying that they just met like yesterday, I think. And there were still some issues. They thought they had agreed on most everything. But after speaking to or reviewing some information from our legal counsel, we couldn't put that on the agenda. Unfortunately, it will be on next month's agenda, I'm sure.
Oh,
So I'm sorry that you didn't get that amended agenda.
Thanks.
I'd like to support you on that, Commissioner Spikers. I apologize in that we haven't gotten the proposed bylaw changes to you sooner, and that we gave you such a late notice to ask to remand this to next month. But I am very happy to say that Commissioner Carter and I spent a great deal of time on these, and we came away with, and I hope that you'll echo, with a great deal of agreement on them. And I'm really excited about what we have coming up.
Okay, well, great. Then we look forward to those changes for next month.
Just a clarification, were there any questions for me or anything you guys would like to know more about for the CEO report?
I would say just simply a fantastic job, and so excited about the hub and the continued tremendous culture that is demonstrated every day in and around our facilities. Thank you.
May I throw out a kudo for our CEO?
Mm-hmm.
I was with her at the Carnation City Council meeting, and I tell you what, I'm surprised that she wasn't elected mayor on the spot. Her presentation was really concise, and we actually recruited some patients in that visit. It was quite an experience.
We're always recruiting.
Shamelessly.
Yes. Oh, no. Oh, absolutely.
Keep reporting out on those leadership rocks. I love hearing about those.
Oh, thank you. Yeah, we do too. They really warm my heart to get to do those. We will try to do more of that for you. Maybe, Trish, we can add, instead of patient story, we can add a rock story as well.
I love that idea.
On the community outreach presentations we've been doing, the response from the community is just overwhelmingly positive, and just excitement, and just I can't even express to you just how unifying this hub project is for the community. And it's not just Snoqualmie. Carnation is excited, North Bend is excited. It's been really, really wonderful. So I hope you guys can be really proud of the work that we're doing here together as a team, all of us.
Mm-hmm.
Yes. Okay, if there's no other questions or anything you want to know more about, I can move on to the dashboard for you.
All right, let's do that.
Okay. Foundational elements, 2 of 5. We've got 2 providers recruited. Dr. Moore, quick question. I want to make an announcement. We have signed an ENT. So for our specialists, if you haven't heard, breaking news, we will be having an ENT joining us by the end of the year. And so I'm excited. I can't remember if that ENT is counted in there, if that's separate. It might be counted. In community health, doing a fabulous job, thanks to Director Pand for the record day and the outpatient in the clinics. But remember, this is all outpatient. So this is MRI, this is lab, this is imaging. It's everything is included in there. Seeing some record volumes across the organization in many different areas that Patrick and Tammy will share with you later. financial stewardship. A note to this one, we are trying something new with this graph. Last month, it just didn't really resonate with us on what the goal was. And so we've adjusted it a little bit. And we're going to just to try to track the budget dots each month, kind of like we do on the finance dashboard. So we'll see how that goes. It might get a little crowded, but so far we are far above our budget. And obviously we'll expect that to get closer to that line by the end of the year. Ideally it wouldn't, but that's the bottom level of acceptance there, that budget line you're seeing on there.
Yeah, can I translate that a little bit for
Yeah, please.
the board?
Thanks.
So that $540,000 is what was budgeted for a loss through February, and we have only lost $480,000 through February. So that's what we're actually ahead of budget, doing better than what we budgeted. So that's what that line's trying to show you.
Thanks, Patrick. We're doing well. How's that? We are.
Yes, we're doing better than what we budgeted, which is the goal. Yes.
Yes, that's good. On health system of choice, I just, again, the board should be so proud of the patient satisfaction scores here and the services that this staff are providing to this community. That's just fantastic. And then doing good on the turnover. We're still below our target and looking really good, even better than compared to last year. So for as far as the KPIs for the board go, we are looking good, and I'll entertain any questions. All right, Commissioner Spikers, back to you.
All right, thank you, CEO Jensen, for your report. Very in depth and detailed, and a lot of positive things in it. So all good things. I'll move on to the finance review summary for February 2026, presented by Patrick, our CFO.
Great. Yeah, I'll try to carry on the good news. We did, as I just mentioned, year to date, we are ahead of budget on our financial statements there. So, which is good. We had a very good month. You can see in swing bed and inpatient revenue, we are ahead of budget. ED revenue as well. Clinic revenue is right about at where they should be for the budget. If you recall, we expect a lot of growth at the end of the year, but that gets averaged out across all 12 months that we have there. So that's where each month, the closer we get to the end of the year, we should see that number matching closer to budget there. So as Renee mentioned earlier, our glide path to that is pretty on spot to what we predicted there. So total net patient revenue for the year is at about $10.9 million. We have a little bit of other revenue. That's more of a timing issue. We have our 340B timing and our SNAP funds that we have not yet received so far, first quarter of 2026. Those are usually a little delayed. It depends on when the 340B gets processed by the pharmacy company, the PBM and everything gets back to us. We will expect that number to catch up again more towards the end of the year. So 10.9, 11 million in operating revenue. Expenses, you can see what Renee mentioned earlier. I would point out the big reduction in expenses there is that contract labor expense. We projected a budget of 729,000 spend year to date, and we've only spent $300,000 on the contract labor. So that's really good that we've been able to have convert agency to full-time staff or employed staff there. So that is a good place to be with that contract labor. You can see that total operating expenses were 10.6, total revenue was 10.9. So we did have a nice net income in February, which, as you know, is a short month. It's 3 shorter days than January, and yet we still had a positive operating income, as well as when you take a look at, we had a positive February as well. So our net position is $481,000 loss, but we had budgeted 530,000 loss. So we're actually have a $50,000 to the plus side there. So good numbers for the year. We expect to see some grants coming in later. That's really going to flip this over even more on the positive side that we've seen come through. There's about $700,000 for the rural health transformation. There's also a receivable that we're predicting for the cost report as well. That will make 2025 numbers come up as well, what we expected. So overall, really, really good strong financials in an investment year when we're building a $130 billion building next door. So good to see that coming through. Any questions on the income statement?
Could you repeat that $130 billion?
That was my rounded up number, Emma.
Billion, right? The billions, okay.
Thank you, Patrick. Congratulations. Yep. Good work from the finance team.
The team's doing well. I can't, we've been having really good discussions every month about where our revenues are, where can we catch up on it, what may be missing, what can we do to hold down expenses. They're sharing ideas with each other in the leadership. So it's been a fun time to sit down with them, and I've tried not to put them to sleep during the finance talks during that. So that's always positive as well. Taking a look at the balance sheet, you can see our unrestricted cash and investments. It actually has gone up since the end of the year. So that's good news. We're actually building cash even though we have a net income loss for the year because we're able to have some improvements on our patient accounts receivable there. So our patient accounts receivable AR days is down in the mid 40s, which is a really good number for us. So we're collecting that older revenue, bringing that in. In addition, we're actually billing out more as well because as the volumes have increased, you can see the total AR went up to 16 million, but that's all new revenue that's come at the beginning of the year from those increased volumes on the med-surg floor through the ED, through the lab, through rehab, on the clinics as we're getting busier. So positive numbers to see that there. Any questions on the balance sheet?
So what do you see at the end of this year? Because you have a preliminary year-to-date actual from 12/31/2025. And right now.
Yeah, Emma, when you compare a balance sheet, you're always taking a look at the prior period as your comparison for. So you look at the full year as the date of 12/31. And so as we go through the months there, you'll see where we are on the balance sheet for the ongoing months going forward. So that's where your year-to-date actual gets compared to your preliminary at end of the year. So you want
well,
your.
I understand that too. So I guess I was questioning where are we going forward at the end of 2026?
Sure, that's a great question. So you can see that line where it has the almost $16 million in restricted cash and investments. That number is going to go down. And that's the money that we borrowed to build the hub next door. That's what that restricted cash line. So what you will see is the restricted cash go down as we build the new building that will change into an asset on below when you're looking at your long-term assets. Once the building's actually, we can move in and everything, and we've received our certificate of occupancy, it moves from what's called construction in progress to actual the building access there. So that cash is going to change into a building asset, and hopefully our restricted cash and investments that are around $24 million there will stay steady throughout the year. That's our hope for that. And that keeps us right at that 100 days of cash that we're looking at as our target.
Okay, and so I'm trying to be clear about our budget for the hub, the total budget upon completion. And you mentioned it will be 130 billion. Is that?
No, not billion.
Well, I
No.
asked to repeat that.
It was roughly 100, and when you're including all the FF&E and everything in there, and the money that we borrowed to pay for the interest while the building is being built, as well as while the building is ramping up, right? You borrowed money to cover your debt service on that. There was about 130 million that we borrowed.
Okay. Because I asked to repeat that, and I thought I heard you say billion.
No, sorry.
You were here.
I'm
You
sorry,
heard me.
I think I heard billion also.
Oh.
Sorry.
I heard billion, not million.
Maybe it's just this room.
Because I repeated it. I said 130 billion, right?
Yes.
I had to repeat it twice to make sure I heard you clearly.
I'm
So
I'm sorry.
what is
Look,
our total budget?
Just let's get a little specific here. I believe the building itself was 95 million. The land was
Correct.
another 5 million.
Yep.
And then there was the North Bend clinic, which was almost 1.5 million. And then there's some potential for overages that we stuck in there. Am I
Yeah.
even close?
You're
That was
you're
9
right
million.
around the ballpark there, Commissioner Spikers. And then you add in the money we borrowed for the debt service coverage for the first year and a half onto that, which is about 1.5 million a month. So that's about 18 months worth there. So that's where that 130 it roughly comes to. And then we also, as you know, refinanced the 2015 bonds with that money too.
Yep. Then we also have about 15 million in equipment costs that we're going to need to incur, right?
Some of that FF&E, it's about 9 million that we have with that, 9 to 13 million, and we're keeping it on the lower end of that so far. So that's been good.
Okay. I just wanted to get perspective of exactly what this money represents and where it's going and where it's gone. Okay. Thank you.
And also, just for the record, so the public that might be listening are aware that because of the great efficiencies and planning that Renee and Dick and the entire construction team, what they've done is we've came out with some efficiencies that has actually enabled us to expand some things that we had to originally put on the hold for further development, perhaps down the road, that we're able to actually bring into the scope of this project in the timeline that we're working in. And I don't want to give away Renee's or Patrick's thunder here, but it's just been a phenomenal success story thus far. And it's just great to watch it unfold. So congratulations and thank you deeply to all of you.
I agree with that, Commissioner Hadley. They had me on time and on budget.
It's good.
Right.
So taking a look at the cash flow statements, we are net cash from operations. We've spent about $1.5 million year to date. That is mainly due to the increase in our employees' wages that we know that we're hiring for ramping up for the hub, as well as we've converted a lot of the staff from agency staff to full-time there. And then we have so that's where that 1.5 million spend there. And then we have our investing activities, which if you scroll down a little bit there, we have about 8 million, and that's our construction in progress so far year to date. Most of that is due to that, as well as the increase in the our tax receivable, decrease in that. We add that every single month to spread out over the 12 years. The cash flow from financing, though, you can see is positive. That is what we've used to invest into the new building. We have our accrued interest earnings, which are good, and our property tax that receivable is increasing as well. So that's important there to see that. So total cash at the beginning of the year was 145. We've spent about 5.5, mostly on, of course, the hub related projects. So our current total cash, and that includes unrestricted and restricted together, is $140 million.
Is that what we have on hand? Is that what it is?
Yeah, we have.
So that is good for how many? 100 days? Maybe
No, that would be about 300 days or so of cash.
I thought I heard you say 100 earlier.
Yeah, the
Okay,
unrestricted Emma is about 100 days.
100 days, okay.
Yeah, but total cash, but we're still able to earn interest on that restricted cash because it has not been spent for the hub project yet. But we will see those bills starting in June and July. We will have expenses of $12 to $13 million a month that will be going out for that hub project. So we will see that cash total go down.
Thank you.
So taking a look at it, you can see our days of cash, which is our unrestricted, up a little bit over the 100 mark, increase from January to February, which is good. Our days in AR are down in that mid 40s range, which is good. We've increased employees, hired employees. We can see our average payment has gone up as we've added employees. The net patient revenue, that is down compared to budget, but as you know, we have a loss on our budget for this year, but we are still above net patient revenue where we were in 2025. So that is, and we were almost right on budget in February. You can see the blue dot right on top of the purple dot there, or underneath the purple dot. Wages and benefits and contract labor is going down. That's a good sign for that we're have good controls on those expenses, and our net income again is where we expected it to be.
How many average paid employees do we have now?
That's a great question. It's a little over 300 employees right now. I'd have to check with the exact number with HR to see what that number is.
And what's the percentage of contractual agents or, or employee, contractual nurses?
So Emma, I had spoke to that earlier, and Trish, you could tell me, I think maybe one.
I think we have one, yeah.
Okay.
There's a few contracts winding down as we onboard some of our newer staff. And so there's more than one, but the contracts are ending.
All right.
But once those contracts roll, we'll have one.
Congratulations on the conversion of contract to full-time staff. That
for
speaks
sure.
volumes about the culture, and then there's an economic savings there as well.
Yeah, these are travelers and agencies that are choosing to stay. So that's really because the culture is that good up there. So it's really good.
I shared in the finance meeting that we had. I personally have had comments face to face by some of those people, and they're just absolutely elated to be on our team.
I'm glad to hear that we are working really well on our retention process.
Mm-hmm.
So we don't have revolving doors here. Thank you.
We've also seen recruitment efforts are becoming much easier because there's a lot of excitement about the work that we're doing with the hub. And there's a lot of great staff that are actually live in this community that are out migrating to other jobs in Seattle and Bellevue, et cetera. And they're choosing to come here because of this project and the work that we're doing. And so I write welcome notes to our new staff every Monday, and it's fun to see the addresses that are North Bend and Snoqualmie, and it's just fantastic. And recruitment of staff has become much easier with the momentum that we've had. So that has been a large part of it as well.
Thank you. That sounds fair. Sounds good. Thank you.
I think that's my cue. I'll go ahead and get started. I will build on just because I can't help myself with CEO Jensen. She's absolutely right. We have had providers start seeking us out. And I know I mentioned this at Finance Committee, but it bears repeating. We have had any number of providers, to include ones that we didn't plan for, like interventional radiology and pulmonology and sports medicine and others, who are coming through HR just cold calling and wanting to talk about working here. So that is a really fun place to be in. It's exciting. I'm speaking to every one of them that I can, even just to let them know that if not now, then when. So it's a really cool feeling.
Mhm.
All right, commissioners. So as often with these slides, I like to give a pause and see if you have any questions to start before I pull out just a few data points.
Are we on RHC and non-RHC clinic visits? Is that what you're?
We are, Commissioner Herron. So we are on slide, gosh, don't know if I can see it. It's 131. So on this slide, we are looking at outpatient volumes to include our clinics. And that does actually call out now our North Bend clinic. So it's great to see this graph, great to see it trending up. Of course, we don't have an actual and we don't yet have a budget line on there, but we are seeing an increase there with the North Bend clinic. That is with Dr. Pasupaletti. I think you'll recall, joined us in January, a wonderful internal medicine physician to join Dr. Postiglione, our nurse practitioner, who opened that clinic for us earlier in the year. They are getting along fantastically. The community loves it, and you are seeing volumes climb significantly there because of the effort of those two with staff. I'll also remind you, our registration staff at North Bend were ones who were putting out sandbags in flooding earlier in the year. So again, all around a great team.
And Tammy, I also had the privilege of chatting with some of the members of the tribal community that support the healthcare needs for the tribe. And they were mentioning that they are really enjoying the access at the North Bend Clinic, and that has really meant a lot to them. And it has made access more accessible for some of our tribal members. So it's a win-win for that as well.
Thank you.
This is not related, but I want to thank you, Renee and Jennifer, for printing this in large font, and also the screen's better, much better. Thank you.
Yeah.
All right.
See better. Thank you.
Yes.
All right, I will move on to talk about the RHCs and urgent care. You do see the trend line down, and I thought it might be educational somewhat for some of you to think about what seasonality means when it comes to healthcare. So we have flu or respiratory season, which Commissioner Bowers will know well. And the way that works is everybody comes in with all of the crud. And what we saw this year, 2025 and 26, was a significant decline in flu activity from 2024-25. So that means the total number, we do this count by counting how many people a week in King County go into EDs. And we saw a decline from about a high of 851 the first week of February, declined all the way down to 406. Now that's a regional number, but it impacts us as well. So you see that trend line dip from January to February in the RHC, the urgent care, in lab, and you're going to see it again in the ED. That's one data point, one upper respiratory or viral illness, but it can have great impact across the district in terms of volumes. So I thought that might be helpful from a seasonality perspective to understand more deeply what that means. Are there any questions for me?
Just very quickly, Tammy, I love these numbers. I understand the seasonality. I also understand the flu. May I ask, this may be a divergent question, but where or what is it we're doing regarding immunizations for the community?
Great question. And there was a question at the Finance Committee as well regarding this. And while I don't have specific data around vaccination for flu in particular, I will tell you a couple of things. One, again, as you know, the flu vaccine is typically created using the viral strains from the year prior. So its efficacy, how well it works, will vary from year to year, season to season. So while we did see a decline in flu rates across our region this year from last, we continue to vaccinate a significant number of both our patients, paneled lives, and those that were from the community. I can get some numbers for you and bring back next time on the penetration rate of flu versus years past in particular. But overall, I feel like we managed flu very well, even if it was a milder year.
Commissioner Bowers, can I ask a quick question? Because I want to bring that data point back to you. We can follow up after the board meeting. Are you asking about our vaccination rate of the community or the staff? And are you talking about like what percentage of the community or staff have been vaccinated? Can you clarify your question?
Sure. My question is a little bit broader. It's just to talk generally about what it is we're doing and how we're advertising immunizations for the
Yes, very good.
Yeah, so I think just in general, we obviously anytime a patient comes to the clinic, we offer them their vaccination during flu season. And of course, we keep track of our kiddos much more closely. We want to look at them, make sure they're getting theirs through the child vaccine program. We also go out into the community. So any business that invites us, we will come and do some flu clinics, or we have done some of the long-term care places as well. So we're pretty active in offering that. And Dr. Moore has also been working really hard with the clinic team to make sure that if a community member shows up and they're not an paneled patient, that we'll also provide vaccine to them as well. So we're pretty good about getting that out there. Our marketing team also does a great job on social about getting the word out that vaccines are available here. And maybe that's more important this year where there isn't a pharmacy specifically in Snoqualmie, because a lot of the pharmacies also do provide those vaccines. Is that responsive to your question?
That was perfect. Thank you.
Okay.
Do we also have a travel clinic?
Pardon?
Do we also have a travel clinic? Because in one of the reports, it showed that we are offering some travel shots for the community.
That's a great question, Emma. Yes, we have the medications available, and if you don't have to have a specific travel clinic. If a patient comes in to see their primary care provider and says they're going to be traveling overseas to a specific location, the provider will just look up what that location is and what the recommended vaccines are, and they'll provide those for that patient.
Oh, okay. So we're informational then.
Yeah, it's just letting the community know that if they're going to be traveling, that we can help meet their vaccination needs. So it's just kind of getting the word out to make sure that they know it's a resource for them.
It's a great service.
Thank you.
You're welcome.
May I answer any other questions on this slide before we go to the next? Okay, here we are on the next slide. So if we look at this volume, you'll see the modalities across imaging to include mammography, ultrasound, MRI. We saw decline in almost all of our modalities, though pay attention to, again, that x-axis and where the number drops to. So if you look at mammography, we spoke a bit about this at Finance Committee, but it looks like that dot in January was just above 80 and is just not that much below. So probably a difference of about 4 to 5 exams. We continue to work in mammography, however, at getting more staff to join that program so that we can represent and do our exams 7 days a week. So I'm hoping by mid-year we can hit that metric. MRI visits were also down, as were CT, and they did with CT visits anyway. You can see that decline matches the 2025 actual, and it is under budget, but again, tie that to a decline in ED visits.
And I would say the ED total number of visits was less, but that's just because there were 3 short days. In February, their average visit per day was the same, was 19 to 20 patients a day. So that's where February can be a little bit deceiving when those numbers dip down so far. It's really the average patient per day that we're looking at for February to make sure that we're not missing out on there.
Thank you for that, Patrick.
We also had some inclement weather, which probably had some impact on that.
All right, if no questions on this slide, we'll go on to the next. Thank you, Jen. And on this final slide, as CFO Ritter just described, emergency department visits did appear to be down, but again, considering it was a short month, we did see a slight uptick in patient admits from the ED and a decline in observation hours. Again, medical unit is working hard to ensure that we have what are called affectionately heads in beds. So the swing bed program did very well, and we saw an increase in our numbers there. while our inpatient was flat, was stable from January to February. So the teams are working hard there on the volumes. Any questions for me on this slide or anything to call out?
The swing bed seems to really went upward. That's good.
We like that number, Commissioner Herron.
So I think if I heard it correctly, we don't really have any vacancies. Is that correct?
Well, it's a bit different day to day. So when you look at the average daily census, you are looking at it from a day-to-day perspective, but that is an average divided by numbers of days in the month. So if you're talking about February, we did very well as compared to January in that average census was higher overall. So we are always, go ahead, Renee, I see you getting ready to speak.
Sorry, I just
No,
want to
please
call out
do.
too that you have to add the graphs together. So we are separating the inpatients from the swing beds on purpose, and then also the observation hours, because we are looking at trying to increase the acuity of the patients. And so we want to differentiate between a swing bed patient and an acute care patient. Our goal is to continue to increase the number of acute care patients that we're treating, and that because that means fewer transfers and more people that are getting care closer to home. So keep that in mind. If that swing bed continues or starts to drop and the inpatient goes up, that's a good thing.
So the acute care beds, do we have 24 and 2 for Medicare or for?
No, so because we're a critical access hospital, that's why they're called swing beds, because they can either be subacute beds, skilled nursing beds, or they can be acute care beds. They can be either.
Okay. Thank you.
If no further questions. All right, thank you so much for your time.
Thank you.
Nicely done.
So I think the next items is the warrants. Is that correct on the agenda?
It should be. And I'm
Bring
going to
up the
make a
warrants,
motion.
please. Okay.
Okay, I'm going to make a motion for $6,096,498 in warrants for the month of February 2026. And, well, I'm sorry, that was the total in accounts payable. The payroll disbursements, adding those in would be $7,762,211. I make that motion.
I'll make a
approve the
second.
warrants. Any discussion? No discussion?
I have some comment, Dave. Thank you very much. The efforts made, by the team are absolutely fantastic. The level of detail of reporting here for us, again, is fantastic. So congratulations to everybody, and thanks for all the hard work.
So with the first and second, no further discussion. I ask for anybody in favor of the passing the warrants, say aye.
Aye.
Aye. Anybody not or abstaining? Passes 5-0. Warrants pass 5-0. All right. Now the next item is commissioner comments, I believe. So I will call on commissioners to make comments, starting with Commissioner Carter.
Thank you, President Spikers. Thank you for your letter earlier in the meeting, the one to Tina Spikers. I objected because I hadn't read it. I didn't want to be spoken for, but I agree with everything you said. I agree that access is really important. I've seen it improve. I'm seeing, I'm posting it on Facebook. I'm seeing it on social media and now on the website. Thank you to the tech team. Thank you to the marketing team. There's a big old banner link that I really hope helps people achieve access to the meetings. Meanwhile, though, in response to all the public comments, I saw some of that behavior today in tonight's meeting. where I saw veiled and overt attempts at bullying our staff. And one of them, Commissioner Herron, I found it offensive and rude when you asked the state auditor about credential requirements for our financial leadership team. That was not an appropriate place if that was really just meant to be an informational question. And if you are instead calling into question the credentials of our finance team, I think that's rude and wildly inappropriate because they're doing an incredible job and they are putting out incredible numbers. And I didn't think that that was okay. Also, you know, President Spikers, with the conversation with Skip Hauser speaking in hypotheticals, we all recognize that situation that you were speaking in hypotheticals about, and I don't get who you're trying to intimidate or what with that. You know, I think that it's important that people get to have their public comment. I believe that it actually might be at the discretion of the chair. I tried to read the RCW, but I couldn't concentrate and be at the meeting at the same time. So, you know, even if it's at the chair's discretion, please, I urge you to leave the floor open, let people talk. You know, I look to Council Member Kat Cotton of the Snoqualmie City Council, who is on this meeting. They were over 2 hours in public comment earlier this week because of a proposed construction project on the ridge. 2 hours, something like 50 comments and a whole bunch of written comments. And that level of engagement is what I think we should strive for and not try to shut down. You know, thank you, everyone. We're trying. I didn't even want to have like negative commissioner comment like this because of all of the wonderful things that came out of Renee's report and out of, you know, Trisha's stories and so many, and the incredible quality committee work. You know, so many great things happening here, and I didn't want to cast another cloud because I thought that we were going to start on an up, you know, start the week on an up note, but I really had to get this stuff off my chest, and I was tired of us kind of, you know, saying, oh, well, commissioners should, or I am hearing. Like, those are two specific things that I heard from two specific commissioners that I found inappropriate, and I wanted to name it. Thank you for your time.
Okay, thank you for your comment. Okay, Commissioner Haugley, go ahead.
Thank you, President Spikers. Oh boy, as a team, we all move the dial, don't we? We, in our efforts to work together, we still have opportunities for growth, and we have opportunities to pat ourselves on the back with some progress that's being made. And I can feel it, and I hope others can as well. And while we so easily can extend grace, sometimes it's not the right thing to do as well. But to be candid and honest with each other. And so I thank everybody for all the efforts that are being made. It remains an amazing experience every time I drive up to the hospital and I see the hub. And there's no better billboard than that building that's sitting on that hill, you know, and people can't really drive by the parkway and not notice that. And they're learning with all the great work that so many, Renee and so many are doing out in the community, really telling our story. And I am so happy about that. And we all try to do that almost on a daily basis. So it's just an honor to be a part of this organization for me. And I thank you all.
Thank you. Thank you, Commissioner Haugley. Commissioner Bowers.
Well, when it comes to my opportunity here, I feel like a kid with ADHD on high levels of sugar when I think about all the positive things we can be talking about. And I hope that our focus narrows down to that. As a commissioner candidate, I made the rounds with all of the commission board members, with the staff, and with Ms. Jensen as well. I came away with the understanding that each and every one of the people involved is talented, intelligent, hardworking, and dedicated to the progress and to the to bringing great healthcare to this valley. It pains me to have heard the comments that we heard in our board meeting last time and to some degree tonight. But I think we have an opportunity now to turn the page. It's time, in my opinion, to focus on what it is that you collectively have brought to this community in terms of the excellent quality of healthcare and the excitement about the expansion of services here. I think it's time to focus on those. We've got so much that we can be crowing about in the community. I look forward to the opportunity to being out in the community, talking about the new providers, the new facility, the new services that we're providing. I dedicate myself tonight to looking to the positive for each and every individual involved in this. There's so much good to say, and I look forward to hearing it as well. Thank you.
Thank you, Commissioner Bowers. To the board, staff, and community, district policy encourages employees and officials to report concerns regarding business practices, suspected fraud and waste, and violations of applicable laws and regulations. Board members each share a responsibility to report such concerns, and retaliation against anyone who does so in good faith is inconsistent with the district's stated values and bylaws. After more than 20 years of service, actually 242 months, to this community in my role as a board commissioner, I am resigning from the hospital's board of directors effective immediately. Throughout my tenure, my focus has remained on patient well-being, the integrity of the healthcare system, and the trust our community places in this institution. I have raised concerns that I believe warranted appropriate transparency and oversight. Under the current circumstances, I believe stepping down is the most appropriate course of action. My commitment to accountability, transparency, and ethical leadership remains unchanged. I will cooperate with any appropriate review or inquiry related to my service. I remain proud of the district's clinicians and staff who serve patients every day and whose professionalism reflects the highest standards of care. Last, I formally will put you all on notice that all emails, texts between commissioners and Renee Jensen and/or Jennifer Scott be preserved in their original form and not deleted between the date January 29th, 2026 through March 26, 2026. I will have a follow-up letter to the board concerning my request for public disclosure. Thank you, and it's been an honor.
Do I get to?
Yeah.
Commissioner Herron, Commissioner Bowers would now be the person in charge of the meeting, and I'm sure that he would allow you to have your public comment.
Absolutely.
Okay, good evening, everyone. First, I'd like to just respond to your comment, Commissioner, sorry, Carter. My question regarding certification and all that is because I was not aware. One of the things that I'm not aware of the number of employees that are certified CPAs, and because we are having a major project, just want to make sure that we are in line with what we are, presenting to the board. And so I just wanted to make sure that that there's no requirement of that. And I don't think that is offensive. It's an information question. I don't see how, and the person, if they were offended, they would have said so. Because that was not my intention. I just want to clarify that. But thank you for your feedback. And tonight, as much as I have to say, I also appreciate all the work that the executive team has done. We are doing, sounds like we are doing super. Time will tell, of course. I'd like to, my comments tonight will be based on the last month's meeting of February 26, 2026. Please bear with me, it'll be just 3 to 5 minutes. And I'm speaking from the heart. And if I offend you with what I'm about to say, because these are my comments, observations, and opinions, please let me know. But I am being transparent about it, what I saw last month's meeting. So it was quite an evening, and I'll be reading from my notes. So because I feel I can express better that way. It was quite a meeting, an evening to remember. I want to take this opportunity to share my comments, observations, and opinions. As I said, I'll be reading my notes to express them better and clarify and clearly for transparency. It is essential that we listen and understand the root and cause of reasonable and unreasonable expectations on all sides of the spectrum. I know we're not perfect. I just have two to comment on: open public comment and YouTube posting. But first, I want everyone to know that SVH Board of Commissioners is committed to ensure that all voices are heard. We ask that we respect one another and take time to pause, because it is critical in transforming healthy human relationships and open communications. Again, I'm not perfect. What I'm saying is from the heart. And if you find it, let me know, please. The public comment portion in the agenda was meant to hear from the public their views or comments on items or projects related to what the hospital is undertaking. And we did that tonight. It was really good from the executive team. And other related components of the business that is of public interest. I don't think it was designed to create a forum for what seemed to constitute personal attacks, complaints, or employment grievance. After all, this was a business meeting to inform and update. For those who would rather vent out and be heard, the board is always available to listen and provide a proper venue to engage in a discourse or dialogue. The chair was respectful and kind to give the staff this opportunity, but it went out of line. People often say, respect begets respect. It is a two-way street, not a one-way. As the time goes on that evening, the speaker's emotions were flying high and way provocative for anyone's taste. It needed a yoga instructor to help with deep breathing relaxation exercise to diffuse anger, threats, and resentment. Second, the YouTube posting for public access to the February 26th board meeting was, I think, unnecessary and irresponsible. I felt it was targeted and timed perfectly well. The evening meeting was recorded because it will have the biggest impact and intensity for public display to humiliate the district. These are my opinions and my comments. I question why not post it on SVH website, as it has always been, and keep it there. This local posting has always been the district best practice for the local community, consistent with easy access for the public without requesting it. And why do the public have to ask for it? It should be available anytime, has been the practice in many years. Do we ask our YouTube users to request SVH video recordings? I think not. Do we think it should be the world's public to view or listen to unpleasantries and negativity? Is it in the best interest of the district and a good use of district taxpayers' money? Does the entire universe population even care what goes in our local district? Let's not kid ourselves. We can call it whatever we want, but this particular recording was targeted, selective, discriminatory, and out of alignment. I think it was meant to publicly humiliate the board and not educate the public, and so on. All the issues I mentioned could have been avoided if it was handled respectfully and resolved internally. It could have prevented escalation of hostility, humiliation, and system of dysfunction as it continues this evening on our open public meeting. Lastly, I would also like to add, for the good of the order, it is a practice in the many years since I have been on the board that we start our meeting announcing the governing rules of procedure for orderly public comment and expectations that the rules of our board meeting ask the public to respectfully refrain from personal attacks, insults, and offensive behavior, threats, and speak to inform and update or educate. Always operate on a simple fundamental principle of respect, and we all know that. I think sometimes it misses the picture. It requires that we respect all stakeholders and members in our community and the district. Thank you.
So prior to calling for adjournment, I'd like to make 3 points. First of all is to commend Commissioner Spikers for 2 decades of dedicated service and hard work to this community, both as an attorney and as a commissioner who's deeply involved in the community. I'd like to thank him for that service. I'd like to also thank he and the other commission members for taking my hand and bringing me along as a commissioner. There's a lot that I need to know, and I probably don't even know what I don't know at this point. I ask for your support, continued support. I'd like to ask if there are any final comments, maybe 2 minutes. I know we're running far beyond our time, but are there any further comments? If you would please limit it to 1 minute, I'd appreciate that.
Commissioner
Mark,
Bowers, I respect that you're taking comments, but before you would call for adjournment of the meeting, we do have an executive session tonight.
Yes, absolutely. Okay. I agree. So are there any comments? Second
I see
call.
one.
Okay.
Jen, would you like to call on the people that have their hands raised? Carter?
Yes, I see Nicole Paz.
Are you guys able to hear me?
Yes.
Yes.
So I'd like to share why we chose to post our videos on YouTube and then link them to our website. That's actually a practice that dates back to 2016 for the district. And I can post the link to those older videos in the chat. We followed that practice because YouTube is a free platform that allows us to host videos freely for our website and allows for greatest transparency so no one has to ask us for the links. So that's why we're doing that.
Are there any further comments?
I don't see any other raised hands, Chair Bowers. Let me scan through and make sure, but I do not believe so.
Chair Bowers, what Renee had commented about the executive session is all I was going to bring up as well.
Yeah, thank you. Any further comments? Thank you. Yes.
Do we need to have officer elections, or is that next month?
Yeah, you're 2 steps ahead of me.
Oh,
My third point is
Yeah, I
the
think
bylaws.
we can finish out this meeting as is and then address at the next meeting.
I agree.
Chair Bowers,
Bylaws call for an election for the vacated position of president of the board. We will take that into advisement and make a notice very soon about that.
Chair Bowers, I just want to cut in real quick. Mr. Hauser, his phone died, so it's only me here representing our law firm. But before you enter executive session, I just want you to make sure that you note that you're going into executive session. You do have to announce this. RCW 42.30.110 1 small I. So that is the specific provision that we're going into for executive session.
Thank you, Brandon.
may it suffice to say that we are going into executive session for exactly that purpose. Do we need to state the purpose?
You do not.
The RCW is fine. And Commissioner Bowers, we anticipate approximately 10 minutes.
Great. With that, do I have a call for adjournment of tonight's board meeting?
Oh, no, we don't
Oh,
adjourn,
no.
sorry. Yeah,
Oh.
no adjournment. We have to do
Chair
executive
Bowers,
session.
we had to go into executive session first, and then when we are done with the executive session, that's when we would adjourn. Thank you.
Thank you. Thank you
And
so much.
for those that are still on, we do not anticipate any action after executive session. I appreciate all of you for your time tonight. Thank you. And Jen, if you'll move the board and myself to the room, and Tammy as well, please.
Renee, is your
I'm working on it. Thank you.
Sorry.
Jen, if you can hear me, you can close the room.
Great, I can do that.
Thank you. Do we have everybody? I don't see Commissioner Bowers yet.
Just had him in another room, Jen. So we had Commissioner Bowers and Commissioner Herron, and then it flipped back to this room and now they're
No,
gone.
there they are. I see them in
Okay,
the
very
South
good.
Conference. They're just not on video yet.
It shut off our mics and our cameras.
Yep.
Gotcha. Okay.
Yeah, Commissioner Bowers, you'll have to unmute yourself if you can.
Mary Miller is still with us. Very good.
Renee, do you maybe want to text Commissioner Bowers and Herron and I can run upstairs and help them unmute if they're struggling?
Yeah, or I can look. Is Brandon, are you still with us too? You are also off camera and on mute. That might be a new update for Teams.
Tricia, thanks for staying late.
There he is.
There we are.
Am I back?
You
Sorry,
are back.
I've been here.
Oh,
Okay,
and I see
weird.
Commissioner Bowers came off mute, but they have no video. Commissioner Bowers, if you can
Do
hear
we-
me,
I can see and hear you.
excellent. We can't see you, but that's okay. We are at the conclusion of our meeting. If you would like to call for adjournment, you may.
I would like to call for adjournment. We'll be coming out with direction relative to the bylaw vote for the president vacancy. And do you have a timeline for when we will come to that arrangement?
We'll consult Skip in the morning and then we'll give you guys direction from there.
Awesome. Do I have a call for adjournment?
So moved.
Second?
I second.
Have a great evening, you guys. Thank you so much for all your hard work.
Thank you.
Good night, everybody.
Have a
Bye-bye.
good evening.
Good
Good to
night.
see you.